So currently in the East Alabama area, the trends for numbers are increasing, which means the number of tests being done, the positivity rate, the number of people hospitalized with COVID, all are up. And that trend is looking like it will continue at least for the next couple weeks or more because of the post-Thanksgiving effect. We've continued to work closely with the Alabama Department of Public Health, which is the state entity that handles the vaccine availability. And we are on track to be one of the entities that receives vaccine supply. The first entity, obviously, to receive vaccine supply is going to be the local hospital. So in this case, EAMC. Then we should be in the second round. As far as the specific timeline, that is up in the air still. But because we are a research facility and have access to ultra cold freezers that already exist, that is not an obstacle for us to take in delivery of the vaccine. Safety of the vaccine, again, it was tested on 40 to 50,000 people. It would not get the licensing if it was not safe. As we give it out to more people, there will be reactions that will happen. But we have a pretty good idea that the vaccine is effective and safe. So the CDC dropped a number of new changes, which quite frankly, I was hoping for more than a couple months, and specifically as it relates to reducing the quarantine time period, etc. The data is being published. We have not made the full adjustments yet because I'm trying to see the actual raw data that was out there. But I think this is a positive step in the right direction. So stay tuned to the A Healthier You website, because that's where you will see what is Auburn's response to those changes. So one, you look for active disease, which is a PCR, a rapid antigen, a rapid molecular, one of those. Those are usually through nasal swabs or oropharyngeal swabs. The antibody test is actually a blood test. So logistically, it would be really difficult to do both of them simultaneously in one location, especially if it's a drive-through location like we have at the clinic. So what we typically are asking people to do is, if you're going to be tested for evidence of active viral presence, then you need to do that based on whatever mechanism we have in place, whether it's the drive-through or coming into the clinic. Once you have been deemed that you may be negative on the active viral presence, i.e. Through the swab, then you can arrange to be scheduled for an antibody test, which can be done if you're having it done at the clinic. Other places may be doing it differently, but it's going to be very difficult logistically to do them simultaneously through the clinic. If everyone follows the protocols and the protocols are enforced, this will be a pretty safe or much safer graduation process than ever before. Okay, so that's a good thing. So I think that it's a positive. I know that a number of the graduates and their families are excited about this, and we're pretty optimistic that we've looked at every possible detail, short of personal accountability. Personal accountability for everyone wearing their masks, keeping as a unit, as a family or as a unit, and not and keeping distance from other units that you don't have typically daily contact with.